The evidence at both inquiries disclosed that patients were let down by the Mid Staffordshire NHS Foundation Trust. There was a lack of care, compassion, humanity and leadership. The most basic standards of care were not observed, and fundamental rights to dignity were not respected. Elderly and vulnerable patients were left unwashed, unfed and without fluids. They were deprived of dignity and respect. Some patients had to relieve themselves in their beds when they were offered no help to get to the bathroom. Some were left in excrement-stained sheets and beds. They had to endure filthy conditions in their wards. There were incidents of callous treatment by ward staff. Patients who could not eat or drink without help did not receive it. Medicines were prescribed but not given. The accident and emergency department, as well as some wards, had insufficient staff to deliver safe and effective care. Patients were discharged without proper regard for their welfare. The many experiences like this were truly shocking to hear. Many will find it difficult to believe that all this could occur in an NHS hospital. The Trust Board was weak. It didn't listen sufficiently to its patients and staff or ensure the correction of deficiencies brought to its attention. It didn't tackle the tolerance of poor standards and the disengagement of senior clinical staff from managerial and leadership responsibilities. These failures were in part due to a focus on reaching targets, achieving financial balance and seeking Foundation Trust status at the cost of delivering acceptable standards of care. Regrettably, there was a failure of the NHS system at every level to detect and take the action patients and the public were entitled to expect. The patient voice was not heard or listened to, either by the Trust Board or local organisations which were meant to represent their interests. Complaints were made, but often nothing effective was done about them. The local medical community didn't raise concerns until it was too late. Local scrutiny groups were not equipped to understand or represent patient concerns or to challenge reassuring statements issued by the Trust. The primary care trusts were under a duty to arrange for the provision of safe and effective care and did not effectively ensure the quality of services they were buying. They didn't have the tools to do the job properly. The Strategic Health Authority was the regional representative of the NHS and the Department of Health. It didn't put patient safety and well-being at the forefront of its work. It defended trusts rather than holding them to account on behalf of patients. It was uncritical in its support of Foundation Trust status for the Trust. It preferred to explain away concerns, such as those about high mortality rates, rather than root out matters which would concern any patient. During the investigation, there was a reluctance by those who had the power to do so to intervene urgently to protect patients. Other organisations, including healthcare professional regulators, training and professional representative organisations, failed to uncover the lack of professionalism and take action to protect patients. At every level, there was a failure to communicate known concerns adequately to others and to take sufficient action to protect patients' safety and well-being from the risks arising from those concerns. In short, the trust that the public should be able to place in the National Health Service was betrayed.